All right, welcome. Today, we're going to tackle a term you've probably heard thrown around a lot, socialized medicine. We're going to cut right through the noise and break down what it really means.
Yeah, you've definitely heard it, right? It gets tossed around in debates, on the news, but beyond all the headlines and the politics, what are we actually talking about?
So to really get a grip on this, let's start with its more formal name, state medicine. And honestly, that name right there, it gives us a massive clue about how this whole thing is structured.
At its core, it's a system where the government, the state, is basically in the driver's seat. They're the ones running and controlling healthcare. And how's it paid for? Well, through public taxes. The big idea is to make it free for every single citizen when they need it.
Okay, so let's break that down. It really comes down to four main things. First, the state is in charge of pretty much everything. We're talking hospitals, clinics, the whole shebang. And it all runs on two really big promises. One, it's free for you, the citizen, and two, it's paid for by all of us chipping in through taxes.
Okay, so that's the what of socialized medicine. But what about the why? I mean, a system this huge isn't just about moving pieces around. It's actually built on some really fundamental ideas, some core principles.
You can kind of think of it like it's built on three main pillars. First up, the government isn't just an observer. It's the provider and the rulemaker. It wears both hats. This leads to the second and maybe most important pillar: access is for everyone. It doesn't matter who you are or what's in your bank account. And that all feeds into the third pillar: the whole system is designed around ideas of fairness, equity, and social justice.
All right, enough with the theory, right? It all sounds good on paper, but what does this actually look like when the rubber meets the road? Let's take a look at a classic real-world example.
When you're looking for a textbook example of this model, Russia often comes up. For a long time, its healthcare system has been pretty much state-controlled from top to bottom, funded centrally, and designed to be accessible to all its citizens.
Okay, but what happens when you take this model and drop it into a totally different context with a different set of challenges? Well, for that, we're going to turn to a really fascinating and frankly complex case study: India.
So if you look at it on paper, India's public health system is actually built on the very same foundation we've been talking about. The guiding principle is universal access. The idea is that any citizen should be able to walk into a government health center or hospital and get care.
Now, that's the ideal, isn't it? The promise. But here's the million-dollar question. How does that principle actually hold up in the real world, in practice?
And this is where we see the real tension. On one side of the coin, you have the principle, this powerful promise of universal access for everyone. But on the other side, you have the cold, hard reality. There just isn't enough money, and there are huge constraints on everything from the number of doctors to basic equipment. And that creates this massive gap between the promise and what the system can actually deliver. So what's the result of that gap? What's the consequence? Well, it means the healthcare services that are provided just might not be good enough for everyone. The system, even with its noble goals, really struggles to meet the massive needs of its population because of these very real practical limitations.
And all of this really brings us to the core theme we've been exploring this whole time: that constant push and pull, that battle between principle and practice.
And that leaves us with this really big, powerful question, a question that countries all over the world are trying to answer. How does a nation bridge that enormous gap between the ideal of healthcare for all and the day-to-day reality of the resources it actually has? Finding the answer to that, well, that's the central challenge in building a healthcare system that truly works for every single person.